your presentation, you focus on the urologic aspects of ATTR amyloidosis. What are the most common urologic symptoms observed in these patients?
The patients have different manifestations from the disease. I would say that probably what the patients complain the most is the urinary infections. They come for the urinary infections, and usually we check the other sort of dysfunction during the appointment. So usually the patient has voiding dysfunction and high post-void residual urine, for instance, and they may complain about going to the toilet too often. They may complain about incontinence, so there are a lot of symptoms. But usually the mainstay is that the patient has voiding dysfunction, and the complaints each patient has depends on each individual case. But usually these are the most common.
What strategy or treatment are currently recommended for managing these symptoms?
Well, for managing the symptoms, when they are related with overactive bladder, we can use oral drugs, usually myrbacterium or viabacterium when available, and we should try to avoid anticholinergics in patients that void spontaneously. You also have other strategies like transcutaneous tibial nerve stimulation, which is a very, very simple way to do peripheral neuromodulation in some patients. And we have other strategies like alpha blockers in men. And we have sacral neuromodulation, which is an increasingly interesting option for some patients because we may eventually normalize or improve significantly the way people void their bladders.
How can effective management of urologic symptoms impact the overall quality of life for patients with amyloidosis?
Well, patients with amyloidosis, like other neurogenic patients, they have a lot of symptoms and they have a great burden in their lives. So it's difficult to live with some neurological conditions, and amyloidosis is one of them. And there's a lot of anxiety and depression. But when we treat these patients from the urologic point of view, sometimes they improve a lot. And this is very important for the patient because if the patient is incontinent, if the patient has urinary infections, if the patient needs to catheterize to void, to drain the bladder, when we help these patients improving from the urologic point of view, usually this is very good for their quality of life. So it's very good for us when we treat these patients effectively.